What the Study Says.
Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May.
Okay, so if you've ever been hit by a migraine, you know it is absolutely not just a headache.
Oh, definitely not. It's more like a full system crash, isn't it? The pounding, the sensitivity to light, sometimes sound, it just stops your world.
Completely. And look, the numbers are kind of mind-blowing. We're talking over 1 billion people globally dealing with this.
1 billion. And it's a leading cause of disability worldwide, especially hitting people right in their prime years, say 15 to 49. That's huge.
It is. And the economic cost, just in the U.S., estimates range from, 6.5 up to maybe $17 billion a year?
Staggering. It's a massive weight, not just personally, but, for society, for productivity, all of it.
Right. So naturally, people are searching. What if there was something effective, something non-drug based, an alternative for this really debilitating condition?
Exactly. And that brings us to our topic today.
Today, we're doing a deep dive into a treatment that's, it's ancient, thousands of years old, but the science is really catching up now. Acupuncture for migraine.
Indeed. And as always, we've waded through a lot of the latest research, the big reviews, the trials, to try and get you the clearest picture we can.
We're trying to cut through the noise, see what the studies actually tell us.
And what's fascinating here is just how much data there is now, and it tells a pretty nuanced story, sometimes a surprising one.
So our mission for this deep dive is pretty straightforward. Does acupuncture actually work for migraine?
Yeah.
For preventing attacks? What about treating them when they happen?
We'll look at how it stacks up against, say, usual care or against sham acupuncture, which is a whole interesting area in itself.
Oh, yeah. The sham studies are fascinating.
And even against standard prescription drugs.
The goal is for you, listening, to come away with a really well-informed, clear view on this therapy. Does it hold water, scientifically speaking?
Okay, so to really get why people are looking so hard for alternatives like acupuncture, you have to understand the sheer scale of the migraine problem.
It's more than just the occasional bad headache.
Oh, much more. Think about losing days, maybe weeks of your life to pain so bad you just can't function.
Yeah.
The WHO's 2019 Global Burden of Disease Survey, it ranks migraine as the 6th most common disorder overall. 6th.
Wow.
And get this, the 2nd leading cause of years lived with disability globally.
The 2nd. That really puts it in perspective, doesn't it?
It absolutely does. It highlights the massive impact on just daily living.
And then you have the standard treatments, the medications.
Yeah.
They work for many, but they're often, significant downsides, right?
Exactly. Patients often run into trouble with side effects, things like fatigue, feeling wiped out, sleep problems, nausea, sometimes even vomiting.
Which are not trivial things if you're dealing with them day after day.
Not at all. And these side effects, they really impact whether someone sticks with the treatment. It leads to poor compliance.
Makes sense if the cure feels almost as bad as the condition.
You're going to keep looking, right? You want relief without trading one set of problems for another. So this fuels that constant search for effective non-drug options.
And that search, for many, leads straight to acupuncture.
Yeah.
Which brings us to the core evidence.
Yes. And one of the biggest pieces here is the 2016 Cochrane review. This is really important.
Cochrane reviews are generally seen as, the gold standard, right?
Yeah.
Really rigorous.
They are. Very high quality. This one updated an earlier review from 2009, and it pulled together data from 22 different trials. We're talking nearly 5,000 participants.
Okay, so a substantial body of evidence. What did it find about acupuncture for preventing migraines?
Well, first, they compared acupuncture added to usual care versus just usual care alone or no preventative treatment.
Right.
And the results were pretty clear. A significant benefit for acupuncture.
How significant? Can we quantify that?
Yeah, so think of it like this. For every 100 people just getting usual care, about 17 had their headache frequency cut by at least half. Just good.
17%. Okay.
But when you added acupuncture to that usual care, that number jumped to 41 out of 100.
41. So more than double the number of people getting that significant reduction.
Exactly. A really substantial improvement.
That's impressive. Did they look at actual headache days reduced?
They did. One analysis showed about 2.17 fewer headache days per 4 weeks after 3 to 4 months of acupuncture treatment.
Wow. Getting back over 2 full days a month for someone with frequent migraines, that's huge. That's life-changing.
It really can be. Which, of course, leads to the next question.
Is it just getting any treatment that sort of attention effect, or is it specifically the acupuncture needles doing something? The sham comparison, right?
Precisely. They looked at acupuncture versus sham acupuncture, and you need to understand what sham means here.
Yeah, it's not just a sugar pill.
Yeah.
It's things like using needles that don't actually break the skin or needling points that aren't considered real acupuncture points.
Exactly. Techniques designed to mimic the procedure without the specific therapeutic intent, theoretically. And the Cochrane review found that real acupuncture was superior to sham acupuncture for reducing headache frequency.
Okay, so there is a specific effect beyond just the ritual or placebo.
That's what this suggests. And we saw similar findings in another big study, a randomized trial in the BMJ.
What does that one show?
It found that manual acupuncture led to, again, a significantly greater reduction in migraine days compared to sham, about 2.1 fewer days over 4 weeks, measured around weeks 17 to 20.
And fewer attacks, too.
Yes, about 1.0 fewer attacks in that same period compared to the sham group, so measurable differences in both frequency and the number of actual migraine episodes.
But here's where it gets kind of weird or paradoxical, right? The sham acupuncture often works pretty well, too.
It does, and that's the fascinating bit, the strong placebo paradox. It doesn't mean acupuncture doesn't work, it highlights just how powerful these nonspecific effects can be.
You mean things like the whole ritual, the focused attention from the practitioner, maybe even the sort of exotic perception of the therapy?
All of that, the patient-provider interaction, the relaxation that often comes with the session, these can create a really strong placebo response, sometimes stronger than a placebo pill.
And maybe even the sham needles themselves do something, like stimulating nerves near the surface.
That's a theory too, yeah. Even non-penetrating needles might activate superficial nerves, sending some kind of signal. It's complex.
So it's not necessarily all placebo, but the context and the ritual are clearly a big part of the picture for both real and sham treatments.
Definitely. Which leads us to the next big comparison people want to know about.
Right. How does acupuncture stack up against the standard go-to prophylactic drugs, the medications prescribed to prevent migraines?
Okay, so back to the Cochrane review. It found that acupuncture was at least as effective as prophylactic drug treatment in reducing headache frequency.
At least as effective, not worse than.
Not worse than, and potentially better in some aspects, according to other analyses. An overview of systematic reviews actually found the effective rate of acupuncture was statistically superior to Western medicine.
Superior? How much superior?
The risk ratio was about 1.17, suggesting roughly a 17% higher likelihood of effectiveness compared to standard drug therapy in those pooled studies.
Wow. Okay, that's a pretty bold statement backed by reviews.
And that same overview. It showed acupuncture led to more headache-free days and less need for painkillers, both short-term and long-term, compared to the drug groups.
So sustained benefit and less reliance on acute medication.
Exactly. Which makes acupuncture a really compelling option, doesn't it? Especially for patients who struggle with drug side effects.
Or maybe people who just prefer not to take daily medication, or those for whom the drugs just haven't worked well.
Absolutely. It provides a valid, evidence-based, non-pharmacological route. The fact that it performs so well against established drugs, often without those systemic side effects, is clinically very relevant.
Okay, so that covers prevention pretty thoroughly. What about when a migraine actually hits? You're in the middle of an attack. Can acupuncture help acutely?
The evidence suggests yes, it can. Another systematic review looks specifically at acute treatment. It found that acupuncture may be more effective than sham acupuncture for relieving the headache during an acute attack.
Okay, so again, potentially better than the placebo or non-specific effects. And compared to acute drugs like triptans or painkillers.
Here, it was found to be at least as effective as pharmacological therapy for acute attacks.
As effective as the drugs you'd normally take when you feel a migraine coming on. That's significant.
It is. It suggests it could be a standalone option for acute relief for some individuals.
And I think I saw something about combining therapies.
Yes. That same review found that using acupuncture together with drug therapy might actually be more effective than using the drugs alone for an acute attack.
Interesting. So it could be an add-on therapy to boost relief if medication isn't quite cutting it?
Potentially, yes. It offers another tool in the toolkit, leveraging different mechanisms, perhaps.
Which brings up the how does it work question again. What are the proposed mechanisms? You mentioned Diki earlier.
Right, Diki. In traditional manual acupuncture, the practitioner often tries to elicit this sensation, maybe a dull ache, heaviness, tingling around the needle.
And that feeling is considered important.
Traditionally, yes. It's thought to indicate that the needle is engaging the body's energy, or, in more modern terms, effectively stimulating the nerves and triggering a response. This stimulation is believed to be key for the pain-relieving effects.
How? What's it doing?
Well, the thinking is it modulates pain signals in the nervous system, potentially influences inflammation, maybe triggers the release of endorphins, the body's natural painkillers, and other neurochemicals. It's likely a complex cascade of events.
And are all types of acupuncture the same in how they might work? Like manual versus electrical?
Good question. There are variations, like electroacupuncture, where a small current is passed through the needles. While both aim for pain relief, the way they stimulate the body and the patterns of brain activation they cause might differ subtly.
So one isn't necessarily proven better than the other for migraine?
The research comparing them directly is still a bit inconclusive. It suggests there isn't one single magic mechanism, but probably a complex interplay depending on the technique, the patient, and those non-specific factors we talked about.
Right, the whole experience, the physiology and the psychology maybe.
Exactly. It's holistic. It seems to involve specific nerve stimulation effects and these powerful contextual elements, the expectation, the relationship with the provider, the relaxation.
So let's boil this down. What are the main takeaways for people listening, and maybe for doctors too?
Based on this pretty strong body of evidence, particularly the Cochrane review and others, acupuncture really can be recommended as an effective prophylactic treatment for episodic migraine.
So it's not just fringe alternative medicine anymore. It's got scientific backing for prevention.
Correct, and that means it really ought to be considered when clinical guidelines are updated. And importantly, it should influence insurance coverage decisions, making it more accessible.
Yeah, access is key.
And clinicians, well, we should be informing our migraine patients about acupuncture as a valid option, especially if they're looking for non-drug approaches, or if they're having trouble with side effects, or if drugs just aren't working for them.
Giving patients more effective choices sounds good, but science never stops asking questions, right? What are the big things we still don't know?
Oh, definitely still questions. A big one is durability. How long did these benefits last after a course of treatment stops?
Right. Do you need tune-ups? Maintenance sessions?
We don't fully know. Does intermittent treatment keep the benefits going long-term? And what's the optimal dose? How many sessions, how often, for how long? Is 10 enough? 12? More?
Practical questions for implementing it effectively.
Exactly. And then there's a fascinating mechanism question again. How much is down to hitting the exact traditional points versus just general needling? Or versus those powerful context and placebo effects?
Untangling all those threads.
Yeah.
That's tricky.
Very. But understanding that better could really help us optimize the therapy and maybe even teach us more about healing in general.
So wrapping this up, what's the bottom line from our deep dive?
I think the bottom line is that acupuncture emerges as more than just an ancient practice. It's a scientifically supported tool for managing migraine.
It offers real, significant relief for many and stands as a viable alternative or adjunct, especially for those who struggle with conventional medications.
Absolutely. The evidence shows it competes well not just against placebo or sham treatments, but head-to-head with established drug therapies, sometimes even coming out ahead.
Which does make you think, doesn't it?
It does. If the body's own healing systems can be activated like this, and even the ritual of treatment, the sham treatments, show benefits, what does that tell us?
About the power of context, the power of belief, maybe, the patient-provider interaction.
Perhaps all of the above. Maybe the act of care, the focused attention, the ritual itself is a more potent part of healing than we typically acknowledge in Western medicine.
It definitely pushes us towards a more holistic view of health, that mind-body connection. Makes you wonder what other non-drug approaches might hold similar potential for chronic conditions.
And how understanding these non-specific effects could actually reshape how we approach healthcare overall. Lots to think about.
Well, we hope this deep dive has given you some fresh perspectives and solid information on acupuncture for migraine. Keep asking questions, keep digging for answers, stay informed.
And if you found this helpful, please do subscribe and share what the study says. It helps us get this information out to more people who might benefit. Thanks for listening.